Recording, guys.
Great. Welcome, everybody, to Let's Talk Porphyria. I think this was an amazing brainchild of Nicole Castellano, able to connect all types of porphyria in a Let's Be community. I think that we often separate into the acute porphyrias and the cutaneous porphyrias, when the fact is we are one porphyria community. And to be able to have this opportunity to share the impact of porphyria on your everyday life, how it affects you in this type of forum, which thank you for recording, Nicole, and thank you for organizing, Nicole. I think it's just a fantastic opportunity. And it makes my heart so happy to see each of your faces. And I've talked to almost every one of you on an individual basis, and you are all so important to me and to the APF and to helping others understand what it is like to live with your type of porphyria. So thank you for being open to this type of platform to share your experience and to hopefully help others normalize what is a rare disease. And this has been an excellent Porphyria Awareness Week. We've had so many people involved in so many different ways. I'm just thrilled at what has gone on, which we'll be doing a wrap up on email on Saturday, or e-news, whatever you call it, on Saturday. But I am just, as always, so impressed with each and every one of you. And this is just yet another platform to share what it is like to live with this disease. So Nicole, thank you for organizing this, and take it away with people sharing their experiences.
Alrighty, well, yeah, I just want to thank everybody for getting on too. I know, like, it's been a busy week. Everyone's got their stuff going on, but I think it's great for Porphyria Awareness Week. This is the time we really get to share, and like Kristen was saying, really get the acutes and the cutaneous people together, because we are one family, and we really are here to lift each other up. And I think it's great that the American Porphyria Foundation has offered, you know, a community online where we can meet each other. And it's just amazing that, you know, up until like a little over a year ago, I had never even met anybody with porphyria. So it's just, even just knowing that people are out there has been amazing. What I want to do is I'm just going to go over a couple things, because since there are a couple people on here that are going to talk, we're going to try to keep to a 3-minute maximum. So I just want to go over a little slideshow, just to kind of just knock out a couple things that we might all want to be saying, so it doesn't eat into our personal time that we're talking about things. So I'm going to just share my screen. And all right, so this is Let's Talk Porphyria. So I'm excited we're doing this, you guys. I just want to go over some ground rules. It's basically to protect people's privacy, and just make sure we stay focused on sharing, you know, what we've got kind of set up ahead of time. You know, we want to give people a peek into our lives, kind of what it's like to deal with porphyrias. I know it's hard to do in 3 minutes, but you know, I just want to make sure that everybody gets a chance to talk. So please use your first name only if you can, and try not to, or just do not discuss any specific treatments, medicines, doctors, anything like that. And let's just try to keep to the time limit so everybody gets a chance to talk, okay? And then I just want to kind of go over what is porphyria for all the people there. We have some people on here that do not have porphyria, which is awesome. Basically, I just want to, this is just a very general breakdown, but porphyria it's an inherited genetic disorder, and it can, some of them can also be acquired, and there are 8 subtypes divided in 2 classifications, but like we were talking with acute hepatic porphyrias and cutaneous porphyrias. The basic concept of how this happens is porphyria arises as a result of a malfunction in one of the 8 steps in the body's synthesis of heme. And basically, it's just how heme is developed, okay? Heme is so important for transporting oxygen through our bodies, and any step along the way of heme being produced that it doesn't happen can cause a different kind of porphyria. And then what happens is there's a buildup of porphyrins or porphyrin precursors, which are normally appear in the body, but they build up and we can't really get rid of them. And so each type of porphyria, and we'll talk about a lot of them on here today, it just represents a deficiency of, which enzyme that's needed for the synthesis of heme. So one of the big things with heme and oxygen is there's one of the biggest things, at least for me, is one of the symptoms we'll go over in a minute is, you hallucinate because you just don't have enough oxygen in your brain. And obviously oxygen is so important, for other things in our body. We've got the acute porphyrias. There are 4 types. Acute intermittent porphyria, which I think is the most common. Hereditary coproporphyria, variegate porphyria, and ADP. I'm not even going to say the whole name.
Aminolevulinic acid.
Dehydratase porphyria. So I think, if I'm correct, I think there are only 10 cases in the world. It is super rare. Yeah. And then for cutaneous porphyrias, we've got Porphyria cutanea tarda. We've got hepatoerythropoietic porphyria, congenital erythropoietic porphyria, erythropoietic protoporphyria, and X-linked protoporphyria. And so you're going to have a lot more. Some of the symptoms cross over, and but basically a lot of the symptoms are, especially for the acute porphyrias, severe abdominal pain. We all get nausea, vomiting. A lot of the cutaneous porphyrias have a lot of skin blistering. There's hallucination, paralysis, weakness. So it's across the board, and even within each type of porphyria, the symptoms it's so individualized, so it's hard to kind of break it down. It's a little bit, it's a little ethereal in that respect.
And I'm just gonna, Nicole, sorry, I'm just gonna add to the cutaneous porphyrias, it's the extreme photosensitivity.
Right. Exactly. Thank you so much. So because we're not going to go into a lot of scientific and medicinal stuff in our own stories today, I just want to put up here it's a great resource. And for more information, you can get basically everything you need to know about porphyria is the American Porphyria Foundation. The website is there, porphyriafoundation.org. I know that, I think that if it was not for the American Porphyria Foundation, I would not even be here right now. It's the only resource that we had years and years and years ago, before it was even a big online community. So I'm really grateful for that. So that being said, I just want to get that out of the way so it doesn't cut into our time. I'm going to get back here to, I'm going to ask Claire to kind of start. And go ahead, Claire, take it away. If you can unmute yourself and just go over the things that we listed in the event.
Okay, can everyone hear me?
Yeah.
Okay, awesome. Thanks, Nicole, for bringing this together and putting this in place. I really, really just love this idea, and I'm so excited to have a chance to speak to all of you. I am Claire. I live in Des Moines, Iowa, and I have acute intermittent porphyria. I actually had a treatment earlier today, so I'm a little sleepy, but I would not have missed this. So there were 3 things that we were supposed to cover. So my first one, check, I said my name and what I have. The second one was the biggest change that I've seen since my diagnosis. And this for me was really, I was a career-driven person. I was the type of person that burnt the candle at both ends, and you just cannot do that when you have acute intermittent porphyria. So I was really forced to slow down and forced to reevaluate what my priorities were in life professionally. I did lose a job while I was in my hospital gown, in my hospital bed before I got diagnosed. So I lost what I would consider my dream job that I had been working to get. I lost it on a Thursday, and then I got my porphyria diagnosis on a Saturday, 3 days later. So it was like a come to Jesus, take a break, so clear message from the universe. And I've really taken that to heart. That was only 2 years ago, and so I have taken my vision for being a change maker in my community professionally and had to rethink of how I can do that with my porphyria diagnosis in a way that serves my body and its limitations. So my number 3, what I'm doing now and how I'm using my diagnosis in a positive way. I've really been able to tell my story about porphyria and about slowing down and about what chronic illness and chronic pain is. You know, you can't see it. We don't look quote unquote sick. And that's something that I know a lot of us get on an occasion. I've been able to join a young adult council at my health system. And so I'm influencing leadership at the hospital that I get my treatments at every single week. So I'm bringing attention, things that, you know, a lot of young adults aren't regulars at the hospital like we are. And so talking about, you know, what this means for somebody who's going through something so chronic to be at the hospital all the time when you'd like to be working full time. And, you know, so I'm advocating for things like weekend hours for the clinic. And I mean, even just a few hours on a Saturday would be so super awesome. But there's a huge language barrier, right? Because I was and am still the only patient getting treated with AIP at my health system. So we had to have a training for all of the nurses and doctors involved in my treatment on what it was and the sort of medication that I get and the risks involved. And that has been really, really helpful. And I guess I'll just end with, I've been able to write a couple of local news articles, and I have a blog, and I find the perception of having a chronic illness is really interesting perspective that people seem to be able to relate to really well. So I would encourage everybody who's on the phone, who's considered telling their story, you can really use it as a tool to make change.
Oh, that's awesome, Claire. Thank you so much. You are
Thank you.
Inspiring, and I know you're a little more new to this. We have some super veterans, and we've got some people who have had it longer and shorter times, but you've just been amazing. So thank you so much for sharing. Jared, I know that you basically, we're not going to have time to get on, so I'd like to, if you could go next, I'd really appreciate it, because we'd love to hear from you, and so we don't keep you on here too long.
Oh, sure. Thank you. Yeah, and I just want to basically just copy what Clara said about this venue and everything that you're doing here. It's really awesome. It's something that I feel proud to be a part of, and I just think it's awesome that you've done this. So,
well, thank you.
I think so. The first, I guess, the questions were, what is the effect of having EPP on my life, and then also positive learnings. And for me, I mean, for all of us, it goes real deep, right? It's not just a physical ailment, it's an emotional, it's a mental, it kind of hits all levels. So I guess for me, I took a few notes, but I just want to talk about how the lifestyle, can you guys hear me fine?
Great, yep.
How we all learn this lifestyle, right? You have this condition and it's like, oh, I have to change my lifestyle. I can't do things that other people can do. And it's not like putting on a different shirt every day. You know, you get one shirt and that's what you get, and you have to learn how to deal with that. So I think as a kid, like testing those boundaries and figuring out, oh, I get burned again. Okay, I'm going to stop doing that. And it can kind of draw a line in the sand of what you can do and what others can do, especially as a child. And I think for me, as I kind of developed in that, because I was diagnosed when I was 3, because I kind of felt like I was in a prison. And what I mean by that is, like, you just kind of feel weird or different or isolated. You feel alone. I felt alone. And that's tough enough as a kid, because you're kind of going through that gauntlet of adolescence, and that can be difficult as it is. But with EPP, it was especially isolating for me. So I think that development for me, I became more introverted, which has its pros and cons, which many people may not know. But I think as I grew up, I kind of realized I had to kind of develop in ways that I avoided when I was younger. So this is kind of a different spin, but for me, it kind of broke down into overcoming those barriers to create more authentic relationships with people versus being like in that victim scenario and poor me type of situation. And no one really likes being in that situation. So I think the positive situation for me of not being able to be out in the sun is to speak up, I guess. So for me, it was, I don't know if I'm kind of all over the place, but.
No, you're good.
You're great.
I realized that other people were suffering just like me. And it may not be EPP. It may not be porphyria. It may be something completely different. It may not be an ailment necessarily. It may be just feeling sad. I don't know, maybe depression. And then I turned to my girls, you know. I've got two young daughters, a 9-year-old and a 5-year-old, and I look at them and I say, I remember being that age and feeling isolated. And that's when it became something a little bigger, and I needed to speak up, I guess. And that's kind of when I started the Porphyria J platform and tried to get involved. And the APF was always there as a kid. I remember there were, I'm trying to remember the term for it now because people don't do it anymore, pen pal. You could be a pen, you know, you could be a pen pal as a kid, and you could write other people and things. And but it's grown so much more. I mean, even the new website, everything that you guys are doing, I'm proud to have my community, you know, and that's a big deal to me. So I think for me, being able to share and be vulnerable, that has been a positive thing, because being vulnerable helps you connect with other people, and that's what this is all about. So I guess that's the positive thing that I've taken from it.
Well, that's wonderful. And yeah, your Porphyria J is absolutely incredible. Your summer shade videos, like that race that you did, I literally was in tears. It was amazing. I mean, it's so difficult to do, much less like, you know, being out in the sun. Like, I don't know how you guys do it. I know we all have our particular things, but that was just absolutely crazy. But it's really great job with that. Thank you for always doing that. And we always look up to you for that.
Thank you guys. I love you guys. Thank you so much.
We love you.
All right, I was gonna ask Anne to go next. She is a caregiver and she is amazing. Anne, if you can take it away, it'd be great.
Okay, my name is Anne, and I don't have porphyria. I am an advocate, mother, and caregiver of Candace, who has HCP, and she's had this about 27 years, developed around the age of 13. Many years to get a diagnosis, and then not being diagnosed, and then coming back to being diagnosed again. I guess for a caregiver and being a mother and an advocate is difficult, and the pain is different. You have the pain, but you don't have, you have the pain in your heart. You watch your daughter go through losing friends, losing a job, trying to deal with even family members saying, you know, get over it, just, you know, just go on with your life, there's nothing wrong. So that type of pain is of course different than all of you suffer, and I thank you all for sharing your stories. It makes me very weepy. I love hearing everybody's stories because it makes me know that Candace isn't alone, and having this community for her and for myself has been a godsend. Being involved with all of you has just been really good for me because it helps me understand it more. It's hard to watch somebody for 27 years grow from a young young teenager to an adult. And so then your caregiving and your advocacy has to change because you can't hover over them anymore. And so I've had to learn how to step back from Candace and to give her space and let her develop on her own. And as a mother, you don't want to do that. You want to constantly be there and giving her advice and trying to run her life. And so it's been a learning experience for both of us. I have learned to just take cues from her now and just wait for her to ask for help and just always be there for her. So I do the insurance side of it all, which is so difficult for so many of you because of the hallucinations and the nervous effect on your brains. But she, with this community, has come out of her shell, I think, to get more involved with her disorder. So that's what I do. I'm just there as her mom, caregiver, and advocate. I thank you all.
Oh, thank you so much. And you are a rock star with insurance. I just had a huge ordeal that lasted a couple months, and like you just like kept me sane. So that was amazing. Thank you so much.
You're welcome. You're welcome.
I also want to add that like you are like the #1 Porphyria advocate. Like if you have
my mom
Porphyria
has not spoken
and
yet.
Anne meets you, she will make you her child. The first
I
time
will.
Anne and I met, she was like, "Yep, you're my daughter. I love you," and I always feel loved by you. Thank you so much for everything you do, not just for Candace, but for all of us.
You're welcome. I love you all.
Ditto, ditto. We love you too. Megan, since you're on, let's do it.
Yes. Alrighty. So if I have to like abruptly stop in the middle of this, it's like acting like it might rain where I'm at. But anyway, so I'm Megan. I live in Arkansas, and this is Rocky. I have porphyria, acute intermittent porphyria. I guess the biggest impact that porphyria has had on my life, like so many others, is that just realizing that my everyday life was going to have to permanently change. Initially, in the beginning, I thought, oh, yay, I have a name for this. And now, where's my pill? Everybody else gets a pill. Where's mine? But that didn't happen. And so I had to make some pretty serious lifestyle changes. I was diagnosed in 2006, so I'm a kind of a veteran now, but in the beginning it was really tough. I mean, it was definitely a game of just kind of figure it out as you go, and you know, it was trial and error for sure, like Jared was saying earlier. And there are a lot of things that, you know, I did it and I'd be like, oh, I think that might have made me sick. So I'd wait a few weeks and try it again. And if I got sick, then I'd be like, okay, that's something I know to stay away from now. And kind of as things have progressed, I know how to listen to my body. I know the difference between other illnesses, like say being sick with the flu versus porphyria. You know, we get so in tune with our bodies that I think that it's almost a blessing, because I feel like I even now can tell when I'm getting sick, even if it's not porphyria, long before, you know, a normal person would. I guess, well, I totally spaced out. What was my second question, Nicole?
Just if there's anything positive that you've been able to kind of glean or learn about life or yourself, you know, from having to go through everything that you've had to go through with porphyria.
I think one of the coolest things, and it kind of feels funny to say that, but one of the coolest things that I've experienced from porphyria is people feel super comfortable opening up to me in everyday life when they hear that I have this chronic, you know, potentially life-threatening condition. I don't know what it is, but I often hear things from people that, you know, they probably don't even tell the closest people around them. And it's a very intimate perspective that I get to have on even strangers that I meet and have these little tiny interactions with. And I do feel very blessed to get to see people in such a vulnerable state. It's nice to kind of have that kind of human interaction where when you share something vulnerable, there's something else, somebody, turns around and shares that back with you, and you kind of have that connection despite whether or not you both have porphyria. For example, when you and I first met, I had gone down to the whole hotel lobby, and there was a man down there who had a prosthetic leg, and it was just airbrushed to the nines, and I commented on it, and he said something about my port, and we got to talking, and the next thing you know, I found out he was there with a conference for a bunch of nurses, and they all came over and wanted to hear more about porphyria. And it all started from him sharing about his prosthesis with me, and me talking about my port and porphyria. I just think that that's really a special thing that happens.
You are so real, and it is really easy to open up to you, and it is wonderful to be able to share that with people, because I've noticed that too a lot, but people really sometimes need to talk to someone, and it's nice that they find someone in you to be able to do that. It's awesome. I've got someone here who's got their hand up. It's a phone number. It's 646-704-2847. Are you ready to talk? And now you can
I didn't mean.
I've unmuted you.
I didn't. Oh, well, thank you. I was trying to mute myself. I didn't really mean to try and speak, but this is Kristen, and I'm in Los Angeles. I have AIP, and I just wanted to say thank you, Nicole, so much for setting this up. This group is an amazing source of support and positivity. I was diagnosed several years ago, and at first, before this group was founded in this manner, we had a really small support group organized by Mount Sinai nationwide that we tried to connect via phone, and that was very helpful initially as far as speaking with other people with the disease, but we really were sort of lacking the positivity that's come through with this group now at this point in time. And it's just a whole different feeling and a whole different momentum that we're here to support each other now rather than wallowing in our disease. So thank you, and the attitude is great. For me personally, my journey has been similar to Claire's in that I was very, very, very career driven and had to completely reevaluate and step back and change my directions because of this disease. I've also been lucky enough now for the past 2 years, I'm a part of the clinical trial for Divosiran. And so I just also want to put that out there, that there is hope, because for me, that has changed my life.
That's wonderful. Thank you, Kristen. We all needed to do that to move forward. That's wonderful. Thank you so much for sharing.
You're welcome. You're welcome. I'm glad that my unmute resulted in being able to say hi.
It's wonderful. It's meant to be. Thank you so much. All right. I was going to ask Candace to go next, if that's okay.
That's fine. Hi, I'm Candace. I have hereditary porphyria, or HCP. Let's see, the biggest way that porphyria has affected me, been a significant thing, was probably my diagnosis journey. Kind of heard my mom, Anne, talk about it a little bit. I had a very long diagnosis journey, so the biggest way was kind of time. Time basically, porphyria has basically robbed me of time, wasted away with doctor's appointments and wasting away. I think most everybody can probably relate at some point in time in the diagnosis journey of, in hospital beds and being sick, and while you're going away, going through this journey of being diagnosed. Well, with my journey, you know, it was always different things, being told that it's this, it's not this, it's in my head, and then being given a diagnosis and then having the diagnosis taken away from me and telling me that, you know, it was all in my head. So I went for so many years being undiagnosed. It was, you know, pretty traumatic for us in the beginning, but then, you know, I got re-diagnosed with the HCP, but, you know, it was really good because with that, we went through all of the steps and got, you know, a real confirmation with the DNA. And, you know, you kind of have, when you have that confirmation, it's really validating for you. You know, so I look at it as a positive in the same way, because, you know, you just don't have all of our testing process now is so different and is so much better than when it was so long ago. Because we're talking, this is like 27 years ago when we were doing, you know, all of the testing back then. So in a way, I think we've come so far. So I'm very proud of, you know, the foundation and our doctors and all the stuff that we've been raising with the Porphyria Foundation and all of our doctors and our satellites and everything else. And that's kind of where I've come from now. So I've really helped in, you know, kind of boasting my story and telling people my story in the process and telling them, you know, even though I went through this long journey of getting tested, diagnosed and undiagnosed, my parents never stopped fighting for me. We never stopped fighting to find out what was wrong. And, you know, you just kind of have to stay in the game and, you know, believe what the doctors are telling you and, you know, believe what's going through. But at the same time, you have to talk with your doctors and in a very rational way is what I also believe. You know, there's got to be a two-way communication going through that. But that's what I do now is I try my best to get the word out to as many places that I can and advocate. And I think it's been the best thing for me, learning and journeying and meeting all the people that I can and going forward. And so in a way, I think being undiagnosed was actually, you know, a blessing in disguise. So that's part of it for me.
Well, that's awesome. Thank you so much. You are, you know, 27 years is you are the veteran, I think. When I met you, it was just incredible, all the stuff I learned, and you're just a source of strength for me. And just the fact that you're on here after you just had a hard time and everything, you know, it's just amazing. I love you so much.
Well, I love you so much. And when you put this thing together, Nicole, I basically started crying because this is what we need to be doing, is coming together as a whole and stop separating ourselves individually as porphyrics, because there's so much that we can learn from each other and pull strength together as porphyrics. Mm-hmm. And I love this. I love this idea. And I love it as a routine thing for porphyrics to get on together more and share in their difficulties and their strengths and boost each other up. Mm-hmm. And I think this is long overdue. So thank you for doing this, really.
Do you want to share, Candace, just on that, what you just said, that there have been, this is a typical, like what a patient education meeting looks like when we bring all acute porphyrias and cutaneous porphyrias together and our support groups. That it's been going on for years and years, and we try to be inclusive of everybody. So I love that we're able to do this, you know, critical on a new new platform, new and current platform.
Yeah, I mean, this is what I got to experience just last month or 2 months ago when you guys came to Phoenix.
Yeah.
So yes, this is what everybody was looking for when we were there. They're like, well, is it going to continue? We're like, hopefully we can do that. So thank you. And I love it. So
That's great. Yeah, because one of the biggest things for me, I'll talk later, but was just feeling so lonely for so long. So that's like when we met there was some events that we went to and I met people. It was just incredible to, to have that sense of community. We've got Desiree that's going to unmute herself and she's going to talk. She is the co-founder of the American Porphyria Foundation and is, the one who gave me hope when I was really bad, really sick, and couldn't walk. I was in a wheelchair, and she wrote a book, and I was like, oh my God, finally, like this is exactly what I'm going through. So Desiree, are you on? Can you unmute yourself?
You may have to tell her how to unmute.
Which phone number is she?
She's probably at the bottom, 713 0995.
Okay.
Me?
I can unmute her. Let's see. There you go.
Can you hear me?
Yes.
Yes.
Oh, hi. Oh, okay. Well, I just wanted to tell you that the APF has been around for 38 years. And the problem, however, is that we didn't have social media until these recent years. So did we have patient meetings? Absolutely. Did we have patient conference calls like we're doing now? We've had them for 38 years. Have we had, as you were saying, pen pals and every other thing, In Touch? We had an In Touch program. The problem was we didn't have the technology we have today. And it's just so wonderful for me particularly, who on the old days was sitting at my kitchen table putting patients together, one at a time, because we didn't have the means. And I think it's great at the APF, and those of you who know things that we don't even know, like I didn't even know Zoom was around, but I'm one of those old birds now, and I'm really thrilled that we're growing so quickly because of the technology today, and we're using every bit of it for the benefit of patients. I have AIP. I've had 100 attacks. I've been hospitalized 100 times. I've had 30 times intensive care. I've been totally paralyzed twice. And I want to tell you that wouldn't have happened today. It wouldn't have happened today because somewhere along the line, some doctor hopefully would have found out. And then the other thing is that the testing has definitely improved immensely. Not that we have all kinds of new tests, but we have more knowledge on how to use those tests. And then for those of you who are in a lot of pain, we also now have the support and recognition of chronic pain. For many years, there wasn't even a recognition that there was such thing as chronic pain. The pain was just pain during an attack. So as we grow together and we grow in the technology of the world, it's just a marvelous way that we can meet and greet. And I think these kind of meetings are fantastic. But on the flip side, I think it's wonderful, absolutely wonderful to communicate. But I am also wanting support in everything that we can do. And I'm not talking about financial support. Support in every way we can to get the word out to our doctors and our medical teams. Any opportunity. I love the fact that you met with nurses and told them about. Use every opportunity, because one by one, we can change the porphyria world. We really can. It took one housewife from Alabama and a man whose wife had porphyria. We started with 2 people, and now we have 10,000 members. So, yes, let's talk and meet together, but encourage everybody to get the word out to those medical teams because what we ultimately want is to be well. This is part of being emotionally well. I believe it's emotional wellness, but we want to be physically well. And it takes every single one of us to reach out. And that's what Awareness Week is to be about, is to let people who have porphyria, not just the APF, but everybody, reaching out to their medical community and their community to heighten awareness. So those of you who have all these great stories, just think about what it's taken to get to this point. And you can imagine, could anybody be more thrilled than me? I doubt it.
Well, we can only hope to continue what you've started by. And
Kristen will be, Kristen will be taking over for me at some point very soon, and I'm going to become global director, because just as we were in a fog and a wasteland of information, most of the world is in a wasteland of porphyria information. So I'm going to start all over, starting from almost zero, and we're going to open up the whole world to porphyria. I hope all of you will be praying about that for me, and we're going to see this kind of love for one another happen in other countries, and we're already starting in, and I'll name them later for you because the list is long.
Wonderful. Well, thank you so much. I'm going to ask, I just said part of the reason I'm still here is because of Desiree, but also the biggest part is my mom, Linda. She's here. When I could not think or move, she was there for me. So Mom, if you could go ahead and start, because you're another caregiver like Ann that has a lot to offer.
Okay, good. Well, I'm Linda, and I'm Nicole's mom. Nicole has AIP. I would have to say the hardest part for me at the beginning was the fact that we didn't know what was wrong. We didn't know we kept having all these visits to the emergency room with different symptoms and different things. And we didn't know they were interrelated. We didn't know what the problem was. And it went on for years. She had surgeries that were unnecessary and all this. You guys all heard these stories over and over, and it's pretty much the same with all of you. It's so sad when you realize that it's just because, like Desiree just said, there isn't enough education with the medical staff, with the doctors. They don't recognize, because it's so rare, and it's understandable, but it's still very difficult for me to look at that and say, if they had just figured it out sooner, what a difference that could have made. So the thing that was hard too was that once we did get, after all these misdiagnoses of different things, and it never turned out to be the right thing, once we did get the diagnosis, everything fell into place. But at that point, Nicole was really in bad shape, like she just mentioned. And so she really was incoherent and pain. She was unable to walk more than a few steps. So I needed to be her advocate. I had to do research. I had to find out how to handle this. And I had to deal with doctors that didn't know what they were doing, with insurance companies that didn't know how to handle the claims, with the threat of the insurance company discontinuing the coverage. It was very bad times. But once it all got straightened out, and things have been going better, and my daughter's much stronger now, and she's her own advocate, as you all know. She's very strong, and she does a great job with it. But I still kind of like Ann. I still feel like I'm there in the background, and I'm vigilant, because I just know that there's a lot of ignorance out there in the medical field or in the hospitals and everything, and I just worry that something could still happen. And like she mentioned, we just had an incident recently with the insurance company again. You're like, are you kidding me? This is again, and it's just, it's because a lot of people really won't go that extra mile to figure things out unless we push them to do that. And so I think as as a caregiver, what I wanted to kind of stress is how important it is for us to be advocates for our children if they have it, or for whoever, or for yourselves, because I feel that that it's the kind of thing where if you don't let them know that you know what you're doing, that you are on top of things, they will respect that. If they don't know that you know, then you just kind of get walked all over. And it's good for them to know that you're watching them, that you know what's going on, that you speak up, and that you talk to them about what you know. I mean, like, for instance, just going through this experience, when my husband had a stroke a couple of years, well, in 2016 now, you know, I was no longer this meek person that just accepted whatever was going to come, whatever the doctors would say. I mean, I was right on top of it, and you know, telling them what I thought the treatment protocol should be, and you know, a lot of people would even ask me, were you a nurse? Were you in the medical field? No, but I had to become like that to help Nicole, and it was very, very important. And I think that it's important that you all demand, politely and firmly, but demand what is your right, which is the best care possible. And so I just think that that's the most important thing that I can impart to all of you, is that the education of the doctors, as long as you talk to them and let them know where you're coming from and what you know about it and everything, they'll step back and say, okay, well, let me look into this a little bit. And you do your own research, you figure things out, and you participate in the whole process, and that really, really helps. For anyone that's coming up that's new to this, it's the most important thing that you can do. So that's kind of what I have to say.
You're muted, Nicole.
How about this? I just, you know, I love you so much. And if it wasn't for you, you know, I mean, I would have never made it through this whole thing. So thank you so much. And you're the best. I have, Michelle is here. It's on my screen. It's next to Jared. Would you like to go ahead and speak? And I can't see the video. You want to unmute yourself? There we go. You're unmuted, so go ahead. I can't hear you though. Are you talking?
Can you hear?
Yes.
Okay. Yeah, video's not working. All right. My name's Michelle, and I have AIP. I officially got diagnosed in 2015 with me asking my doctors to test me personally. The reason is my family has a history of porphyria. So I was pretty positive from a young age that I had it, but never officially got diagnosed until later on. And the way it's affected me is it really did change my whole life. It's like I have a whole separate life than what I did before I started to get really sick from porphyria. I was very active like most of you, constantly doing stuff, working all the time, then doing sports, dance, anything and everything. And once I got sick, everything had to change. The whole life, had to take a step back and just slow down. So I'm still trying to get back to the stuff I used to do. Once in a while I can slowly do some of the things, but it's an ongoing battle. And with that, as some of you touched on about just being an advocate for yourself, that's, I think, is one of the best things to do. Is you just have to keep on pushing and fighting. And when you know something is wrong, not accept a no. from the doctors that you're wrong. You have to keep pushing them to look deeper. And by doing that, and then it just helps to educate them more. Every time I come across a doctor, nurse, I talk to them about the porphyria and try to explain to them a little bit about my symptoms personally, and let them know that my personal symptoms is not exactly how someone else is going to respond with the disease, that there's a wide spectrum of it. So they have to keep that in mind when they're dealing with porphyria patients, is how we're all so different. And I guess the positive of it has been really getting to meet so many wonderful people and be involved in the different research and the different programs that are going on now. And just, I'm trying to get involved a little bit more at a time. Not as involved as most people, but it's a process. And I think it's just helped me also to really, like appreciate life and to get a better perspective on how other people may be going through something difficult, but really aren't showing it on the outside. And to just understand that more and have more sympathy towards them, and just to look at life in just a more open way. I don't know, that's it. No.
No, that's wonderful. It's wonderful. And I think that we should all be as involved as we feel like we want to be. There's no, you know what I mean? I think that we'll all fall in and out of, depending on how we're feeling, how much we can kind of, really participate and stuff like that. So thank you so much for getting on, Michelle. It's great to hear.
You're welcome. And thank you for doing this. I really appreciate it.
Oh, no, thank you. I've got Amy. Amy is on. Can you unmute yourself, Amy? I don't know which phone number is yours. Tell me. Is that you, Amy? I don't know. Let's see. Amy, is that you? Hello? Would you, this phone number is 319-310-1084. Did you want to talk about anything?
I'm Claire's mother.
Oh, you're Claire.
And
hello.
yeah, and I am not very tech savvy, so I was able to get on by phone. I'm kind of helpless with this iPad, but I was glad. I appreciate knowing about this teleconference, and I think it's just invaluable what you're doing, meeting like this, however often, if it's monthly, however often you're doing it. I just think is invaluable to all of you. And I'm just so grateful that my daughter has got these resources that you have, offered, and also these doctors who she's met at these events, in like the one in San Francisco and others. And it's been difficult to be a mother and watch your child suffer and be so helpless and not know what to do. And I've been crying halfway through this, so I'm not sure I'll make it. But I don't know if my daughter ever shared, but a long story short, she went to a lot of hospitals, and I was with her, and and I even noticed, I could tell, like, they just treated her like whatever, and she'd say her pain was bad, and then it was like they didn't really believe her. And it was just such a helpless feeling for her. She was so sick, and I don't even think she remembers a lot of her being in the hospital, but I did, and it was very hard for me to watch her suffer, and then she's not getting the care. And And then the last place we went, after we ended up going back there, and it wasn't the actual expert doctor. It was one of his 6 interns who diagnosed it. He came in later and told her, I'm sure you don't have this because it's so rare, but you have all the symptoms and it's only an urine test, so you might as well do it. And then when we got home 2 days later, he called her, and I am just forever grateful to that doctor, because the rest of them really weren't any help at all. They weren't, they didn't do anything. And so I'm just grateful that she was diagnosed and she's getting the treatment she needs. And I know she's been through a lot of pain, and she's still going through a lot of pain, and as you all are. And I just so impressed by all of you. I think it's wonderful what you're doing, helping and supporting each other. And I appreciated being invited to participate in this. It was last minute. I just found out about it a little bit ago, so I didn't have a speech ready or anything, but that's probably enough. But there's probably somebody else who wants to speak. But I do appreciate all you have done for each other and are doing. And I feel very encouraged that you're going to have a cure in your lifetime and in the not too distant future. I really think that, and I pray that. I just think the outlook is really good for that.
Well, you did great. You did great. You got your tech stuff, and you didn't have a speech, but that was wonderful. Thank you so much for sharing. I know it's hard to watch your family members going through that. Thank you so much. I found out.
Thank you.
Yeah, thank you. I've got Amy now here. She's ready to roll, I think. Are you there, Amy?
I'm here. Can you hear me?
Yes, we can hear you perfectly.
All right.
Yay.
Hi, everybody. This is Amy Chapman. I just wanted to take a minute and say thank you, first of all, Nicole, for organizing this meeting. It's wonderful to be able to listen to each and every one of you, whether it be acute or cutaneous types. As you may know, I have AIP, and I just want to let you know, most of you know some of my history, but I am a 3rd generation AIP, diagnosed by Dr. Anderson. And I have monthly attacks typically related to my cycle. But I just want to let you guys know that from one AIP to another Porphyria patient and friend and member, that I truly do appreciate each and every one of you, because I'm not one for social media, but I see a lot of you guys on social media, and you guys are very encouraging to me and to other people. You help me in particular to keep moving forward in my health personally. Some of you may know that I have been sick since December 1st with a lot of different ailments, and I'm just not getting any better. And we're kind of running out of options. So when you guys message me or say hi to me, because I'm on social media a lot, that really encourages me, keeps me humble. And the fact that you guys put forth the effort to become a wonderful friend and community of Porphyria patients is very encouraging to see you go to the education meetings that we have and get to know one another. So I just wanted to say thank you, and thanks for supporting the APF and supporting me and supporting one another.
Well, thank you so much, Amy. You do so much for all of us and keep us connected, and I don't know how you do it when you haven't been feeling well. I literally can't get over it. It's amazing. So thank you so much. You are incredibly resilient and resourceful and just wonderful, and we love you. All right. I've got, let's see. Nadine, did you want to say anything? Hold on a second. Did you want to say anything? Or are you just listening in? All right, let's see. We've got we've got a number here. It's 330-842-9429, or 9489. Did you want to go ahead and talk? Hello? No, I've unmuted. I don't know. Let's see. All right. All right. Is there anyone else that oh, Megan. Megan wants Jason. Are you there? Are you there, Megan? Let's see. No, there we go.
Yeah, hold on one second. Baby, you ready? Sure. Sorry, I'm gonna switch my camera back around.
So excited to hear from Jason. I haven't met you. It's good to see you.
Good to meet you as well. I'm Jason. I'm Megan's husband. And honestly, when we first met and she told me she had AIP, I had absolutely no idea what that was. And I think one of the hard parts is I'm no Doogie Howser myself. So the more she tried to explain that to me, I was just lost. I don't think there was anything she could have put into words that would have prepared me. But as time went on and we started dating, she had her first big attack, and that lasted about 28 days in the hospital. And I can't imagine how she felt, but I was terrified. I kind of got to see it from all stages, and there's a lot of frustration, when you're dealing with medical staff, some that aren't as familiar, with AIP. And of course, that's what took me down the journey of doing a lot more research. And if nothing else, there's only so much you can pull from the internet. I think what I've learned the most is from having those more intimate conversations with Megan, where she can tell me how she feels, or where it hurts, etc., and whatnot. It's been a journey with her, and by nature, I always want to fix things, and unfortunately, that's not an option here. So I think one of the ways I've been able to help is whether I was a shoulder, or when she's down, being able to help her out with some of the day-to-day chores, back rubs. I'll get it in there. Anything I can do to help out, I'm there. And I've definitely got a much firmer grasp on what AIP is and how it affects her day to day. I think one of the things I've learned firsthand is how much I take the small things for granted. And, kind of in contrast, how my day can bebop along versus Megan's, who could fall apart in a moment, or be right back on track in the same day. So it can be a roller coaster. But I've got to say, of the last year plus, we've been extremely blessed. And, her health it's different than it was maybe in our first 2 years together. I noticed that even the days that we're in pain, or maybe that there's symptoms of porphyria coming on, they're not as exaggerated as they were those first couple of years. And I am always looking to see, why is that? What's making the difference? And there's no one thing I can put my hand on or finger on, but I think that I pay attention to what we're eating. And I mean, I'm not a dietitian either, but I know that Megan's going to tell me what she needs. And when you're sick, I mean, this is somebody with porphyria, or this is me, you're not always paying attention to yourself as well as you would be, otherwise. So now that I'm a little more aware of what's going on, I try to make sure that we're getting fluids, or that we're eating right. If she needs her downtime, she needs her downtime. If there's a way that I can be supportive and maybe suggest, hey, let's move around, I'll take advantage of that situation. I don't ever want her to push past her limits, but I definitely want to be there to help her kickstart and get back. And I think that's kind of what's helped us push a little bit of progress. I wish that I didn't live in fear of being so dependent on health insurance in a way that she is, that maybe I'm not. I've got health insurance, and maybe I go once a year, twice a year, if I need to. And there's nothing that's going to stop that, barred me losing a job or anything like that. But hers, it could just be one day we're not covering this medicine, we're not taking care of this, and it feels like all the progress we've made can easily snowball into another direction. And you're kind of at the mercy of the universe or the insurance company, or however you want to look at it. Past that, I kind of come late into the conversation, but I appreciate you guys giving me a chance to speak. And I'm just going to be here with Megan and continue to learn and, take out the trash or anything else that she tells me to do in the meantime. So.
Oh, you're great.
All right, guys. Hey, thanks for letting me speak, okay?
Well, thank you so much for getting on, Jason. It's great to hear. And from the moment I met her, she is just so in love with you, and that I know that helps her feel better. You guys are just a wonderful couple, and I'm so glad she found you, and you're so supportive.
Chicago girl.
Oh, Chi-Town. Look out.
Chicago girl.
Yep.
I bet you can hear it in his accent, couldn't you?
Cicero.
Now, if there's only a way that we could all salsa dance on here with Michelle and everybody, that would be great.
Oh, yes. That would be a blast. Let's go.
All right. That's awesome. Well, thank you guys so much. Is there anyone else that wants to talk? Because I was going to go. I know Nadine was going to go, but she's doing something. I guess I'll just go really quick. I'm Nicole, and I have AIP. And so I'm most likely going to cry because I always do. So those of you that know me do. It's hard for me not to, but I get emotional because it's just been such a big thing in my life, and it just such a roller coaster, as everybody knows. But I think the worst thing for me was, obviously not being able. I was very ambitious and driven, and I had my own business, and I was just so. My self-worth was so wrapped up in being successful and and running my business and accomplishing things. And when you can no longer do that, you kind of feel like, I felt like a piece of garbage. I felt useless. And that's a really crappy feeling to have. The other thing that was really bad for me was, you grow up trusting doctors and stuff. And when they really just didn't want to go that extra mile, I had a hysterectomy that I didn't need at a really great hospital. And it was just a mistake. And, so that was something, I can't have kids. That was really horrible. And you just I lost my faith in doctors a lot because they just didn't really seem to care to figure out what it was. They wanted to just give me pain medication. I'm like, I don't want pain medication because it's a Band-Aid. And why am I having all this pain? What's happening to me? And I never got an answer. And so, I just kept, getting down and down, down. And then, after 12 years with no diagnosis, you kind of start doubting yourself. You're like, is it in my head? Am I crazy? Like, I know I'm not, but I mean, I want to be jumping out of planes and dancing and doing crazy stuff. I don't want to be laying in bed, and so you just doubt yourself, and that's the worst thing. But I would have to say the best thing for me that I've learned is I know my self-worth is not wrapped up in my accomplishments, and that I deserve to be loved and respected and trusted and cared for, like, no matter what, whether I'm doing something great or if I'm just laying there doing nothing, because I know I'm always doing my best. And I just have had this incredible sense of hope that one day that this is just going to be something of the past, whether there's a cure or not. I can't believe I just went a very long time not having my treatment, and it was a dream of mine that I'd had, and like going 3 months, and actually went like 3.5 months, and it was just amazing. And I know that one day, I'm hoping one day that I'll go longer, and if I don't, that's fine too. But I've just with all of you guys, give me a lot of inspiration and hope, and I just love being able to share. It helps me kind of process through everything that I've gone through, to be able to share it and stuff, and to know, like, some people message me and they'll say, hey, because you talked about this, like, that's how I feel, and that made me feel better, and that makes me really happy to be able to talk about it. I didn't talk about it for a long time because It's not that I was ashamed, but it just, you know, I didn't like looking weak. And I realized that I'm not weak, I'm strong because of this. So that's my biggest takeaway. So that's about it. Hopefully I stayed under my 3 minutes. That's probably a record, and I didn't cry. I'm glad we have this on video. Nadine, do you wanna go? I'm gonna unmute you. Do you wanna go next? Are you on there? Hello? All right. Are you there? Nadine? All right. Is there anyone else that wants to go? Because I have a couple. This number that's the 330. I'm going to try unmuting again. Are you there? I just want to make sure that everyone that wants to talk gets a chance to talk. So can anyone just like raise their hand if they didn't get a chance to talk and they want to talk, or maybe just okay, Kristen, you go for it, girl. You
How
go.
can I not speak? I am so appreciative of everyone that has spoken up tonight, whether you have AIP or EPP. I wish we had every type of porphyria on here because every type is equally important. I am a caregiver. I have a son with erythropoietic protoporphyria, EPP. I am an advocate. I have fought for him every single day since he has a diagnosis, had a diagnosis, and I'm fighting every day for each one of you. I have been blessed to be in this role at the APF. I literally talk to hundreds and hundreds of people that are searching for a diagnosis, that have a diagnosis and are finding access to treatment. I talk to the people who have, along with Desiree, that have been dealing with this for years and years and years and still have issues and the same feelings that you're bringing to us tonight. And, you know, Christopher Austin, who is the director at NCATS at the NIH, he said something years ago to me that resonated, which was hope without action is ineffective. So I have such great hope for this community. I think I have heard the word hope across the board from so many of you, and you cannot have hope without action. Being on this call is action, being part of research is action, educating physicians is action, being part of the APF is action. And what I see in every one of you, I just want to continue. And I am blessed to know each and every one of you. And together, we're going to do this. Right? So thank you all. And thank you, Nicole, for organizing this Zoom call, bringing, I think, what we have done for years and years, and what Desiree and the APF has done for years and years to a new platform is just wonderful. So thank you.
Well, thank you so much. And thank you everyone that got on. This was awesome. And I know it was really long. So thank you guys so much for staying on for so long and everything. And we'll have to do it again. So it seems like everyone really likes that idea. So we'll have to explore that. So I love you guys. And I really appreciate getting on. And I'm going to post the video for replay for people that couldn't get on. So people that are going to be watching this on the replay, you know, we want to hear your stories as well, and never stop speaking and advocating for yourself. And let's just try to stay together as a great community. And I think the more hopeful we can stay, I think that we can accomplish anything. So I'm really excited. So thank you guys all again. And we'll do this again soon. Bye-bye.